Alright, so I'm doing my lightning strike on the comparison of laser versus ultrasound. Alright, so my PICO question is, in collegiate athletes, is laser or ultrasound more effective in reducing pain and returning athletes to play faster? So looking at laser, basically laser stands for light amplification by stimulation of radiation emission. And basically it promotes healing through near infrared light and promotes a reaction in the cell that will stimulate healing. There are two types of lasers. There's helium neon and gallium arsenide lasers. The helium neon have more of a shallow penetration, and the gallium arsenide have a deeper penetration of about 3 to 5 centimeters. Basically, laser is used to reduce pain and increase functionality in the afflicted joint, or afflicted body part in general, sorry. So basically, looking at the effectiveness of ultrasound, there was a study done in Japan by Muramoto et al. They basically partnered with the Laser Therapy Association in Japan, and they did a study with 126 athletes that had from 10 different sports. 67 of them got laser, and the rest of them did not get laser. Now, the injuries they were looking at were medial and lateral epicondylitis of the elbow, adductor strains, rotator cuff injuries, Achilles tendonitis, jumper's knee, and yeah, those are the ones they looked at. And they had a pain scale, or like a pain relief scale of 0 to 10, 0 being the best, 10 being the worst. And they rated, they would classify it as an effective treatment if it was anywhere between a score of 5 to 0. So basically, I'm not going to break down all these numbers for you, but 9 patients reported a score of 0, which means their pain was completely relieved. 5 patients reported a score of 10, which means they didn't see any improvement at all, and 2 had a score of 5. The rest of the categories fell somewhere in between. The other one that had a lot of was the score of 3. They had 7 people in it, and then all the rest had 1 or 2. So basically, they found that laser had a 65.9% effectiveness in treating injuries. They did find that there were a few other injuries that laser was actually more effective in treating. Jumper's knee had a 75% cure rate. And then tennis elbow and Achilles tendonitis had a cure rate of 66.6, which was just above the average. So it seemed like for tendinous injuries that laser did a pretty good job. But for the more actual muscle belly injuries, like adductor injuries or rotator cuff injuries, that it wasn't nearly as effective. Alright, so now moving on to ultrasound. Ultrasound is a deep heating modality that is basically used to increase tissue temperature. It can be used either in direct contact on the skin or through conduction through water. Doesn't really matter. Basically, it uses inaudible acoustic waves to produce a deep heating thermal effect that will increase blood flow to the area and hopefully promote healing. So, alright, so looking at the effectiveness of ultrasound, there were 2 studies I used for this. One was done by Knight et al., and it found that after 6 months of daily ultrasound usage, the cure rate was 80%. And then there was a study done by Carnes and Barton, who found, they did a study on rats, and they found that with 7 days of continuous and nonstop ultrasound, on muscles that had a contraction-induced injury, they found that those muscles at the end of the 7 days actually had an increased amount of force production. So looking at that study, you can surmise that basically if it is an injury, so something like a hamstring strain or like something that you would get from like a forceful contraction of a muscle, that ultrasound is definitely going to be effective there. Alright, so now if you're going to be comparing the two, you're going to look at laser and ultrasound side by side. There was a study done by Ahmed et al., and he had 3 groups. He had his control group, a group that got a gallium arsenide laser, and then a group that got ultrasound. And basically, what he found was that the laser group and the ultrasound group had no statistical difference between them in their treatment. Not in their treatment, in their results total at the end. There was no statistical difference between them. They were the same amount effective. And there was a second study done by Demir et al., and he found that 5.5 minutes. He found that laser and ultrasound separately worked well together, but when you combine the two, it was much more effective than the independent laser or the independent ultrasound was. So basically, in my opinion, I would say if you are dealing with a tendinous injury such as jumper's knee, Achilles tendonitis, epicondylitis in the elbows, I would say, not so much epicondylitis, but Achilles tendonitis and jumper's knee, I would say that using laser is your best bet. And then if you're dealing with more of a contraction-based muscle injury, like we talked about earlier, like a strain, ultrasound would be your best bet. And then if you're dealing with something where it would be viable to combine the two, I would say that will give you the most effective outcome overall.